Hello everyone, and welcome back again to my YouTube channel. My name is Ijay in case this is your first time, and I am here to talk about some health problems that we should be made aware of, some health issues that we should have knowledge about in order to help either yourself or your loved one or anyone you know that may be affected. Before I go on, please, if you've not subscribed to my channel, please do well to click on the subscribe button. It is totally free and help this channel grow. Thank you. So in today's video, I'm going to be talking about type 1 and type 2 diabetes in pregnancy. And we all know what diabetes is, and type 1 and type 2 are the types of diabetes that can be found, in pregnancy. So type 1 diabetes is when the pancreas does not make any insulin for the body, and type 2 is when the pancreas makes just very little insulin that's not enough, and therefore the body becomes resistant to it. So I wouldn't want to go into further details about type 1 and type 2. I just want to go right into type 1 and type 2 in pregnancy. So before getting pregnant, that is called pre-pregnancy, it is very good to check out your blood glucose level. So a good blood glucose control prior to planning pregnancy is really important. So it is recommended that you check your HbA1c. The HbA1c is a blood test that shows your average blood sugar level over the past 2 to 3 months. Level prior to conception. Your GP or diabetic consultant will advise on a target level and advise you not to become pregnant to achieve this level. It is also advisable for all women and birthing parents with diabetes to take a high dose of folic acid, usually 5 mg, 3 months prior to conception and first 12 weeks of pregnancy. This reduces the chance of a particular defect called a neurotube defect. It's a spinal bifida in baby. This high dose cannot be bought over the counter and must be prescribed by a doctor. I want to talk about some medication. I know there's a medication called metformin. It can be used in pregnancy, but you have to stop all other oral blood glucose lowering agents before pregnancy and use insulin instead. Now, during pregnancy, I've talked about pre-pregnancy. I'm here now to talk about during pregnancy. So how pregnancy affects diabetes. So you have increase in blood glucose level and need of insulin. So pregnancy increases your blood glucose level and makes blood glucose control more difficult. So you may need to be started on insulin in pregnancy if you are on oral medication. Insulin requires increase greatly in pregnancy. And at the end of pregnancy, you may be on 2 to 3 times as much insulin as you were before pregnancy. Diabetes in pregnancy needs close monitoring. So this may mean appointments like every 1 to 2 weeks, to diabetic clinic. So there's something also called hypoglycemia. It's a low blood glucose. It's also known as hypo. So pregnancy can make you less aware of low blood glucose as well, particularly in first trimester. The symptoms you normally get with low blood glucose are shakiness, dizziness, sweating, hunger, irritability or moodiness, anxiety as well as nervousness, headaches, and you may be less noticeable than before. If you're taking insulin, always have a fast-acting form of glucose available. So another way it can affect during pregnancy is diabetic ketoacidosis. You may develop complication called a diabetic ketoacidosis if your blood sugar level is very high and you are unwell. If you're a type 1 diabetic, the risk is higher. You'll be given ketone strips tests and advised to seek medical help. Another way it can affect is diabetic retinopathy. This is a problem at the back of the eye. Pregnancy can cause diabetic retinopathy to worsen. So you may be offered some eye screening, at booking of pregnancy as well. There's also something called diabetic nephropathy. This is a kidney problem associated with diabetes. Pregnancy can cause diabetic nephropathy to worsen. Also, blood glucose monitoring. This is the most important thing to be doing in pregnancy. This can be hard as it is required daily for the whole pregnancy. The target range for glucose during pregnancy is narrower than usual. Your diabetic team will explain this to you, when they review your levels during your hospital visits. How diabetes can affect pregnancy. There are several ways diabetes can affect pregnancy. One of them is miscarriage. If diabetes is not well controlled, it increases the risk of miscarriage. Another way is congenital anomalies. It's a birth defect. So if in your first trimester the blood glucose level is managed poorly or controlled poorly, this can result in your baby not developing properly. These are referred to as congenital malformations or birth defects, and this can range from minor, such as cleft lip and palate. A cleft is a gap or a split in the upper lip. Some babies, when they give birth to them, you have some gaps on their upper lip. That's as a result of a congenital anomaly. There's also something called preeclampsia. Women and birthing parents with diabetes are more at risk of preeclampsia. Preeclampsia is a condition that affects some pregnant women and birthing parents, usually during the second half of pregnancy. That's from 20 weeks, or soon after their baby is delivered. So early signs of preeclampsia include having a high blood pressure, that's hypertension, and protein in urine. It is unlikely you will notice these signs, but is usually picked up during your routine antenatal appointments. All women with diabetes are therefore advised to take a low-dose aspirin, usually 150 mg, from 12 weeks of pregnancy until delivery, as this reduces the risk of preeclampsia. Another way diabetes can affect pregnancy is having a big baby. Poor glucose control in pregnancy means your baby receives glucose across the placenta and baby grows larger than average. Delivering the big baby can cause complications at delivery, such as difficulty delivering the shoulders after the head has been delivered. Small baby as well. This is another way diabetes can affect pregnancy. Having a small baby. Also stillbirth, an increased risk of stillbirth, and so there's also another way, which is known as postpartum hemorrhage, having heavy bleeding at delivery. Postnatal, so there's a risk that your baby will develop low blood glucose. We advise early feeding of the baby to try to prevent this. You could collect colostrum from 36 weeks onwards. Your baby's glucose level will be monitored every 2 to 3 hours for 24 hours after delivery. Increased risk of admission to special care baby. Your baby is at risk of admission to special care units due to low blood glucose level, breathing difficulty, jaundice, early delivery. After delivery, your blood glucose control will quickly return to how it was before you were pregnant. So the dose of insulin you take after baby is born is likely to be less than the dose you were on in pregnancy. Thank you so much if you've watched this video to this point. I want to say that I am not a clinician. I work in a healthcare sector, but as a non-clinical staff, and we usually have some trainings, to help in acquisition of knowledge and development. So these are part of the things that I've learned, as a result of being a staff working in a healthcare sector, and I decided to share with you guys. I hope you enjoy watching, and please do not forget to like, share and subscribe to this channel, please guys. And thank you so much for watching my video. Until I see you next time, thank you and stay safe guys. Bye.